This is a patient who is 65 years old. You can see the wear on his lower central incisors, a little bit on the sides. He has a bad bite, and there's a number of other problems. He's recently has had 5 crowns done as well. You see some of the recession behind the lower anterior teeth, but he's relatively good at removing all the plaque, though there's some tartar there. See the dark filling that's on the lateral incisor and the darkness that's around it, and it's also on the canine. That's fairly significant. And when we look at the x-ray, we'll notice that there's a pretty good size dark area on the x-ray. You can see to the right there the filling and then the darkness, but it's not all that definitive. And what we'll probably have is we'll take out the filling and see if there is decay there, and most likely there is. These are some old silver fillings that have been there for years. You can see the stress fractures that are in the enamel that connects to them. The interesting thing also is that for the first premolar with the 2 silver fillings in it, there's a fracture line between them as well. That fracture line could actually go all the way through the teeth, and it would be a good idea to take those silver fillings out and see what the extent of the damage is so that the patient wouldn't lose the fillings. Here is the lower left side, tooth number 19 and 18. 18 has had a number of fillings done, and you can see how the bonding was compromised, that whenever saliva gets on a filling, the bonding can't occur very well, and you can see the brown area. In this particular tooth, looks like those fillings will need to come out, and it wouldn't be a surprise if there's significant decay. You can see how they're hoping that that tooth-colored filling was bonding underneath near the gum line as well, and the likelihood of that occurring well doesn't show well. You'll see on the x-ray a little bit later how there is a radiolucent spot there. Just looking at that same tooth from up on top, you can see how someone is trying to connect an old versus a new filling, and that seldom seems to work really well. The first molar does have some really large filling on it with some vertical stress fractures around the distal lingual cusp. Tooth number 31 is a very large silver filling with stress fractures. And then the buccal aspect of it also has a fairly good size silver filling. Well, the next 2 teeth are new crowns, tooth number 30 and 31. I'm 30 and 29, and we'll see that in just a second. And the lower first molar has drifted forward and around the gum line. It's just a very difficult place for the patient to clean. Needs to not only use floss, but most likely either a proxa brush or what I like to suggest would be a rubber pick, and having someone visually seeing this and removing that with something that can actually have a little better movement than just floss. There's the other crown, and when you look at those 2 crowns, they look pretty good visually. And on the x-rays, the margins are closed. Here's another silver filling. There is a lot of plaque and tar around the tooth there. Here are the x-rays of the upper teeth and the lower. You can see that the crowns themselves are pretty well placed. There's a little bit of a cleft on the second molar there. But between the teeth there of the new crown, you'll see that there's actually a little bit of a space there where food gets caught. And that's supposed to be completely closed. The adjacent tooth, you can see that that is. But gum tissue also seems to be a little more irritated around these crowns for whatever reason. Either it's difficult to clean or the contours are a little more bulbous than a normal tooth, but it certainly is more irritated than the other areas of his mouth. Here are his anterior teeth. You can see the vertical stress fractures on every single one of them. Besides that, the wear on the incisal edges. Here are the x-rays. The fillings themselves also have different type of bonding material, but the lateral in this particular photo and the filling next to it looks like there is some sort of a leakage problem going there as well. So here's another picture of those anterior teeth, and that one filling on the lateral should be replaced. And here are some really old crowns, and you'll see on the x-ray that there's actually a significant ledge on this particular tooth, while the second premolar right there doesn't seem to have it. And so here are the x-rays. You can also see the ledge pretty adequately there. And when we take a better view occlusally, you'll also see a big space between those two premolars, where every time the patient chews and eats chicken or fish, he gets food caught there. Large filling on the upper first molar, and nothing is all that significant on the second. Here's another view from the outside. A patient has been brushing his teeth, and you can see how the toothbrush has caused the gum to recede a little bit, and the crowns themselves in the bite, you can see the second molar is overlapping in a significant way. Really don't seem to touch the lower teeth very well. We'll go back and check that. And so this next section is to look at how the teeth are actually coming together. The subsequent video on the patient's bite will show that his teeth really don't come together very well. But this is to more or less show that these new crowns on the right side are in full occlusion, and the left side also has areas of problems. You can see a little bit of space there, but there are spots that are touching, and we use some artist or shim stock artist paper, which is about 6 microns, and put it between the teeth and see if it goes through. And right there it doesn't. It seems to be touching pretty well, but the first premolar isn't touching whatsoever. We check the first molar. It's not so bad. It seems to be pulling on it, but behind it, it doesn't touch. All the anterior teeth, laterals and centrals, have no occlusion, and on the right side, some of the posterior teeth, first molar has very limited occlusion as well. So we'll evaluate on an articulator to see if there's something that we can do in regards to getting the patient a better bite.